Each April, we look forward to the CMS rule on Medicare reimbursement rates. Unfortunately, this year, the news was not good. In an unprecedented move, CMS put forth two very different proposals. The first would cut our rates by about 12.8%. This would be a devastating blow to nursing homes and the economic support that we provide. The second option is a more balanced approach and would update our rates by 1.5%. Now, obviously, we all prefer the second approach. However, a more realistic result will probably be some compromise. So we are actively working with the administration and with Capitol Hill to encourage CMS to adopt a rule that provides stable Medicare funding. And we believe our arguments are valid. CMS has based a proposed cut on incomplete data on what they believe has happened from implementing RUGS 4. But this data was compiled with only one fiscal quarter. Traditionally, CMS looks at a whole year's worth of data to determine whether or not it should make an adjustment. Therefore, we are asking CMS to follow its common practice of looking at an entire year of data before making any cuts. Now, in addition to this, CMS can phase their cuts in over several years. They did that in 2007 with in-hospital DRGs, and they did it in 2009 with the Medicare Hospice Wage Index. So we're encouraging CMS to slow down the process and examine a year's worth of data, and then if they think a reduction is necessary, to implement that over several years. Those of you on the front lines know exactly how this cut would impact your day-to-day operations and your ability to remain a strong force in the local economy. Many of you are already coping with cuts to Medicaid and rely upon Medicare to help bridge the gap. Many of you have already made great strides to improve quality and offer choices for your residents. You don't want to see those advancements just disappear. And many of you are worried about having to lay off staff. For some of you, you're even worried about just keeping your doors open. Each of your stories are significant and deserve to be recognized by CMS. So take action today and before the end of the CMS comment period on June 27th. Write or call your representative in Congress to get them to sign the letter to CMS encouraging the agency to reverse this proposed cut. Share your facility story with AHCA to possibly be featured in our association's advocacy efforts, or submit your comments to CMS directly. Learn how to take part on each of these actions on our website, ahcancal.org. If we do nothing, we will lose this battle. But if you take action and our membership takes action, we have a chance. Our residents, their families, and our employees are counting on us to act. Let's pull together and win this important battle.